Well, I'm Dr. Veerina. Been with Cardiovascular Institute for about 16 years, but my relation with Cardiovascular Institute goes well over 20 years. What is commonly thought as cosmetic venous disease or spider veins or varicose veins, when we really started looking at the magnitude of that problem, it's a lot bigger problem and a lot more prevalent, to the point now we think something close to, by some estimates, anywhere from 70 to 80 million Americans have venous insufficiency. If they have varicose veins or unsightly veins, it's pretty evident they have venous disease. But a lot of people without all those problems are walking around. By the end of the workday, their legs are swollen or their legs are tired. They have to sit in a recliner. And most of us stand for living, and most human beings stand up for majority of the time based on our profession. So as we look deeper into this problem, we realize that there are a lot of patients who are not being served, not being treated, not even being diagnosed. Unfortunately, there are really no vein specialists. We as cardiovascular specialists are their vein specialists. So in the beginning, they just have swelling, heaviness, and as the time goes by, they may start having small spider veins and unsightly veins. And in more later stages, they may have varicose veins. Yet in more later stages, they have a lot of discoloration, thickening of the skin. And then much later stages, they can have skin breakdown and venous ulcers. And start by doing a very non-invasive ultrasound in the office, looking for venous reflux. Like acid reflux, veins have reflux. That means basically blood is coming down from the heart, but blood isn't moving back up to the heart, not coming back through the complex networks of veins all the way back to the heart. So the blood is stagnating in the legs day after day after day, year after year. That's putting a lot of pressure, and there is a fluid buildup and leaking into the tissues, and that fluid starts stagnating. Depending on the length of their problems, they start having different problems. Diagnosing them and raising the awareness start with lifestyle changes, start with weight loss, start with exercise, maybe start off by wearing compression stockings. But as time goes by, or if you're older, you have more serious venous problems, we have pretty sophisticated but very simple procedures to solve those problems. So that is where we are in CIS right now. In a more simple format, you're injecting a vasoactive foam in the veins. So the whole procedure can take just about 10 to 15 minutes on a good day. The patients may have some local discomfort and bruising after the procedure, but most times it's really like you have 2 pin pricks. In the case of foam, you have 2 needle bites, and that's it. Most patients are literally advised to walk out and continue to walk the same day of the procedure. So there is no downtime in these procedures. I feel strongly that the burden is upon us to really educate patients, help them out with this very common condition that affects nearly, I don't know, anymore it seems like 40–50% of the patients that I see in the office have venous insufficiency. So it is a very common problem. So I think we have to be on the lookout to help our patients.